Last week and the week before, I've been debating the upcoming health emergency, and it's coming. 5.3 million operations behind on the NHS at the moment, 2-year waiting lists for hip replacements, knee replacements, and almost unbelievably, over the weekend we saw reports out from the Nuffield Trust and the Institute for Fiscal Studies suggesting that the waiting list could go up to 14 or 15 million over the course of the next few years. I've been making the argument that it would make sense to subcontract out things like hip replacements to the private sector to get the job done. And I'm really pleased to see over the weekend we got an announcement that this is actually happening. The government are going to spend $2 billion contracting out many of these operations. They're called routine operations, but I guess if it's you that's having the operation, it probably doesn't feel that routine. But is using the private sector, is this in many ways going away from the founding principles of the National Health Service? Is it, as some might fear, the back door to privatisation? Or does it, as I believe, make absolute, complete, perfect sense? Well, joining me now is Dr John Campbell, semi-retired nurse and senior lecturer in nursing with over 40 years in the NHS and education. And thank you very much indeed, John, for joining us here on GB News.
Thank you, Nigel. It's great to be on.
So when you heard the announcement overnight that £2 billion was to be spent, paid to private providers, private hospitals, to perform operations such as hip replacements, rather than people waiting for 2 years, what was your response to that?
Basically, I think it's potentially good news, but there's quite a few background issues here, really. I mean, at the moment, there's no government in the world can really afford all the healthcare that's available for all of its people.
Sure.
And yet, because these treatments are available, because we have a lot of high-tech treatments and we hear about a lot of new scientific developments, we kind of think we should all have those. And at the moment, I think we're spending about roughly 10% of GDP on health. How much more do we want to spend? I remember when I was a young staff nurse in the hospital, we had 4 general surgeons and we had 2 orthopaedic surgeons. Now we've got about 24 surgeons all working in different specialties. So I really think we need a bit more honesty and a bit more transparency. What can we afford? What can we not afford?
Yeah, and we've got 2 things. That argument extends, of course, into cosmetic surgery and many other areas. But, John, as somebody, a lifetime working in the National Health Service, and thank you for what you've done, because that really matters to society, does it worry you that the private sector gets involved? Or are you one that believes in the principle that it must all be done by the state, it must all be controlled, and that really the privatisation of the health service would be a disaster? Because I know there are many in the country that feel that way.
Not at all. I'm far more pragmatic than that, Nigel. Basically, we want good healthcare of the people, for the people, by the people, at the point of need, and that chronic conditions can be dealt with. Yeah. Because at the moment, we've got this chronic problem. Even before COVID, of course, there was quite a big waiting list. And COVID has exacerbated that. I guess in healthcare, we'd call it an acute on chronic problem. So it's really highlighted it. And it's good to see that Sajid Javid has come. It seems to be talking about the actual figures that we've got reasonably clearly, and the projections that are likely to happen. I mean, there's 5.3 million of the people on the waiting list now. Yeah. But the other thing is there's about 7 million people missing who actually should have been on the waiting list. So I remember hospitals were like spookily quiet for quite a long time at the start of this pandemic. Yeah. Where were the chest pains? Where were the sore tummies, the headaches, and all the things that we usually get in? That there was
John,
just not
I'm with you on this completely. I think the founding principle of the health service was to give people care that was free at the point of delivery. Yeah. And whether that delivery is through an NHS hospital or, frankly, contracted out to a private hospital, what really matters is the patient gets treated. So we're very much at one on that.
There are provisos, though, on that, Nigel, of course. The private finance initiative basically has been disproportionately expensive. Again, I don't want to talk about the old days with rose-tinted spectacles, but in the hospital we used to have our own cooks. We had our own tradesmen. We'd have a joiner. We'd have someone who'd do the floor work. We'd have someone who'd fix the roof. We had all the tradesmen. You know, the baker in our hospital was famous all over the town for producing quality products. Now we get food up in from about 100 miles away on the motorway, and we have all of these things like the portering services. They're all contracted out, and that takes away from the whole esprit de corps, really, of the hospital. It doesn't feel like the community that it used to feel like.
Wow.
And the efficiencies in these things are really open to question. And as well as that, we had things like Staffordshire. They tried to do an end-of-life care that spent 1.2 billion contract. And basically, no one took it up and it had to be dropped. So how this is done practically is fraught with difficulties. We don't want to end up with a situation like the United States that spend more on healthcare than any other country. And it works out way more expensive than any other country because of the inefficiencies of the system and the way that the system is broken down.
Also in America, the risk of being sued, of course, because, you know, it's a very litigious country. John, I want to ask you one last quick question, if I may.
Yeah.
What chance do you think we've got of reducing that waiting list?
In the short term, we can reduce it, but it's going to be there for some time. I mean, people are talking about 2025 before things get back to normal. So we are in for a bit of a turbulent time in the health service. And it's really sad to see because there's people in pain, people waiting for gallbladder operations, hip operations, renal stone operations, cardiac bypasses. All these things cause a lot of human pain, suffering and death. And we're in a very unfortunate situation at the moment. The health service is not really delivering the pace we'd like it to deliver. No. So private outsourcing is one thing. The other thing we used to do quite a bit, I don't know how you'd feel about it, Nigel, is we used to, some patients would go abroad for treatment. So it would actually be paid by the health service. And the surgery might actually be done in somewhere like, Netherlands or somewhere.
I think my attitude is whatever we have to do has got to be done to reduce those waiting lists. And I think that the private sector in this country will expand and help the NHS and maybe save the NHS. Otherwise, I fear we'll be a society of haves and have-nots, those that can afford treatment and those that can't. John Campbell, thank you.
Let's just hope it's synergistic.
Yeah, well, we're going to have a lot of hope because I do fear a looming health emergency. John Campbell, thank you very much for joining us.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.